IMpower010 is a trial in patients with early-stage disease, are patients with a stage 1B with tumor size of at least 4 centimeters, II and IIIA, according to the 70nm classification. These patients receive adjuvant cisplatin-based chemotherapy, and then 1,000 patients were randomized to receive atezolizumab for 1 year or best supportive care. In this trial, primary endpoint was disease-free survival, assessed by the principal investigator. And we previously published the results of disease-free survival in a hierarchy situation, because this is the design of the trial. And first, we analyzed disease-free survival in patients with stage 2 and IIIA and PD-L1 positive tumors. In this group, disease-free survival was longer with atezolizumab, with a hazard ratio of 0.66, than in patients with stage 2 and IIIA. In this group, also, disease-free survival is longer with atezolizumab, with a hazard ratio of 0.79, and finally, in patients with stage 1B, 2, and IIIA. And in this group, the hazard ratio was 0.81, but the statistical significance boundary was not crossed. So we need further follow-up. During this conference, we have presented the first overall survival interim analysis. It's an interim analysis, but it's the first design in the trial, and with 13-month additional follow-up, total of 49 million follow-up of the patients, we have reported results in overall survival. For those patients with stage 2 and IIIA and PD-L1 positive tumors, there is a trend towards an improvement in overall survival for those patients treated with atezolizumab, with a hazard ratio of 0.71. For those patients with stage 2 and IIIA, including all patients, even PD-L1 negative tumors, there is no difference in overall survival between the two treatment arms. And in patients with stage 1B, 2, and IIIA, also no differences in the two treatment arms. So it's important that this trial show that atezolizumab is working in those patients with PD-L1 positive, and at that stage in patients with stage 2 and IIIA disease. We need to wait because patients with stage 1B probably have later recurrence, so these studies are still ongoing. But it's also important that we have analyzed those patients with stage 2 and IIIA and PD-L1 50% or higher, and in this group, the hazard ratio for overall survival favoring atezolizumab is 0.43. This is what we have presented. Also, we have updated safety with 13 months of additional follow-up. And again, the agent is very well tolerated, and no other signs of toxicity have been seen after a longer follow-up.